Now we'll talk about the head, eyes, and ears. The cranium houses the brain as well as the eyes, ears, and other sense organs. Because these structures are crucial to human communication, balance, and sensation, their accurate assessment is paramount. In this program, you'll see how to examine the structures of the head, eyes, and ears, and assess vision and hearing. With this healthy person, you'll see normal findings. In your practice, you may note the same findings, normal variations, or abnormal findings.
Before performing the examination, consider the structures in the areas you will assess. For example, recall the location of these cranial bones: frontal, parietal, occipital, and temporal. Review the external eye structures, which include the upper and lower eyelids, palpebral fissure, medial canthus, and lateral canthus. Also note the location of the iris and pupil. The transparent conjunctiva protects the eye. The palpebral conjunctiva lines the eyelids and folds back over the eye. The bulbar conjunctiva overlays the eyeball. It merges with the cornea at the limbus. Above the eye, the lacrimal gland secretes tears, which lubricate the conjunctiva and cornea and drain into the puncta. Then they drain into the lacrimal sac and nasolacrimal duct and empty into the inferior meatus. Also consider the internal eye, which has 3 layers: the outer fibrous sclera, the vascular choroid, and the vision-receptive retina. The internal eye also has an optic disc with a physiologic cup, retinal vessels, a general background, and a macula, which includes the fovea centralis, the area of sharpest vision. Before examining the ear, recall its 3 parts: the external ear, also called the auricle or pinna, middle ear, and inner ear. The external ear funnels sound into the external auditory canal, which ends at the tympanic membrane or eardrum. The translucent pearly gray tympanic membrane consists of the pars flaccida and pars tensa, and the annulus or fibrous outer ring. 3 parts of the malleus, the umbo, manubrium, and short process, show through the tympanic membrane, and a prominent cone of light is reflected in the antero-inferior quadrant. The tympanic membrane leads to the middle ear, which conducts sound to the inner ear via 3 ossicles: the malleus, incus, and stapes. The eustachian tube connects the middle ear and nasopharynx. The inner ear contains the semicircular canals, cochlea, and acoustic nerve, or cranial nerve 8. These structures hold the sensory organs for hearing and balance.
All right, so we're going to begin your exam. First, I'm going to be...
When the person is ready, begin the head examination by noting the general size and shape of her skull. It should be round, symmetrical, and in proportion to the rest of her body.
Now I'm going to examine your head.
Next, palpate her scalp and skull, which should feel smooth and symmetrical. Particularly note any deformities, lumps, or tenderness. Now slide your fingers to the temporomandibular joint, just anterior to the tragus.
Close.
As the person opens and closes her mouth, palpate the joint, which normally moves smoothly and freely, without tenderness.
Close. Have you been having any headaches recently?
Yes.
When inspecting the person's face, note the facial expression, which should be appropriate for her behavior and reported mood.
Is it sharp or dull?
It's a dull pain.
Observe for facial symmetry as the person speaks and moves. You should see symmetry of the eyebrows, palpebral fissures, nasolabial folds, and sides of the mouth.
No, no problems
Okay,
there.
have you had your eyes
Also
checked
note any tics,
No,
edema,
just
or
maybe last
lesions,
year, no.
which signal an
Do you wear
abnormality.
contacts or glasses?
Yes, I do. I wear contacts.
Okay, so we're ready to begin your eye exam. So I'm going to have you stand on the floor. I'm going to give you this
To
card.
test
and
visual
cover your
acuity,
right eye when I tell you.
have the person stand 20 feet from the Snellen eye chart and hold a card over one eye.
Card and read the smallest line you can read.
If she wears contact lenses or glasses other than reading glasses,
E, F,
tell her to keep them on.
O, D.
Ask her to read the smallest line of letters
Now
possible.
please cover the other eye.
Then have her cover
read
the
that
other
line
eye
from right
and read
to
that
left.
line of letters backward.
T, C,
Normal
E,
visual acuity is 20/20,
O,
which means
F,
that the person can read at 20 feet what normal eyes can read at that distance. Now test visual
Okay, Sue, I'm
fields
gonna
by
ask you to sit at
performing the
table.
confrontation test.
Now I'm gonna
Stand
check
about
your
2 feet
vision
from the
in a
person
minute.
at
I'm
eye
going to
level.
Cover your eye with a card. I'm going to cover mine. Then I'm going to wiggle my fingers to the side of your head. You let me know.
Have
when you
her
see
cover
what I
one
see.
eye and look at
Okay?
you.
Cover your left
Hold your
eye.
finger midway between you and the person.
now,
Ask her to say now as soon as she
Now.
sees it move in from the periphery.
now.
Then flick your finger as you move it in through each visual field. For the temporal field, start with your finger somewhat behind the person. Normally, she should see your finger at the same time you do. And in relation to the antero-posterior axis of her eye, she should see your finger at about 50 degrees superiorly, 60 degrees nasally, 90 degrees temporally, and 70 degrees inferiorly.
Good. I'm going to take your card.
To evaluate extraocular muscle function,
And what I'd like
first
to do is look
test the
straight at
corneal light
and shine this
reflex.
light in your eyes.
Ask the person to stare straight ahead. Then shine a light toward her eyes from about 12 inches away. Note the light reflection on her corneas. It should be in exactly the same spot on each eye. Then perform the diagnostic positions test to elicit muscle weakness. Ask the person to keep her head still and follow your finger movement with her eyes. With your finger about 12 inches from the person's nose, move it to each of the 6 cardinal positions of gaze. Hold it briefly, and then move it back to the center. You should see smooth, parallel eye movements. During downward gaze, the upper eyelid should overlap the top of the iris. There should be no lid lag. During extreme lateral gaze, mild nystagmus is normal. In any other position, it is not.
Good.
Observe the external eye structures. Normally, the eyebrows move symmetrically and show no scaling or lesions. The eyelids meet when closed, have evenly distributed eyelashes, and show no redness, swelling, discharge, or lesions. And the eyeballs look properly aligned and do not protrude or appear sunken. The palpebral fissures may show racial differences. The narrow palpebral fissures that are normal in Asian people may signal Down syndrome in those from other races.
Okay, Sue, can you look up towards the ceiling? I'm going to pull your lower lids down.
Inspect the conjunctiva and sclera. While the person looks up, slide her lower lids down with your thumbs. Normally, the conjunctiva are clear. Their underlying structures look pink in the lower lids and white on the sclera. In some darkly pigmented people, the sclera may be gray-blue or may have small brown macules like freckles.
I'm going to examine your upper eyelids. So please.
Now check the lacrimal apparatus. As the person looks down, slide the outer part of the upper lids along the bony orbit. You should find no redness or swelling here.
Just look straight ahead. I'm going to shine a light on the side of your eye.
Now turn your attention to the anterior eyeball structures. To do this, shine a light from the side across the person's cornea. The cornea should look smooth and clear, with no opacities. In an older person, arcus senilis is common and normal. It is a gray-white circle around the limbus caused by lipid deposits. Then inspect each iris and pupil. Normally, the iris looks flat and even-colored, and the pupils appear round, regular, and equal in size.
Sue, I'm going to shine this light
Next,
in your eyes to check
test the
your pupils.
pupillary
Just
light
over my shoulder at the
reflex,
wall.
which requires you to darken the room. As the person gazes into the distance, move a light in from the side. Observe one eye at a time. The pupil on the same side as the light should constrict briskly, demonstrating a direct light reflex. The pupil on the opposite side also should constrict briskly, demonstrating a consensual light reflex. Remember to test the pupillary light reflexes in the other eye too.
Okay, look at the wall behind me.
Next, test for accommodation.
And look at my
To do this,
finger.
have the person focus on a distant object.
And again,
This should cause her pupils to dilate.
and look at my finger.
Then hold your finger about 3 inches from her nose
and again at the wall.
and ask her to shift her gaze to it.
And once more
This
at my
should
finger.
cause pupil constriction and convergence of the axes of the eyes. Record normal pupil findings with the abbreviation PERRLA, which stands for pupils equal, round, and reactive to light and accommodation.
Sue, I'm going to use this to look inside your eyes now.
To inspect the ocular fundus, prepare the ophthalmoscope. First, turn it on and select the large round aperture with the white light. Then adjust the diopter to 0. After darkening the room, ask the person to stare at a fixed, distant object. This helps dilate the pupils and steady the retinal structures. With the ophthalmoscope in your left hand, hold it up to your left eye and inspect the person's left eye. Begin about 10 inches away and 15 degrees lateral to her line of vision. As you shine the light at her eye, a red glow should fill her pupil. This is the red reflex, which should be uninterrupted by opacities. Now move in on the 15-degree lateral line until your foreheads almost touch. Adjust the diopter if needed until you can clearly see the ocular fundus. If you both have normal vision, the diopter should be at 0. The optic disc should appear creamy yellow-orange to pink and round or oval with distinct margins. The physiologic cup should be brighter, yellow-white, and no more than half the width of the disc diameter. Follow a paired retinal artery and vein out to the periphery in 4 quadrants. The artery should be brighter red and narrower than the vein. As the vessels reach the periphery, they should grow thinner and show no AV nicking or crossing. The general background should appear reddish-brown and clear, with no lesions. Finally, inspect the macula, which normally is 1 disc diameter wide, darker than the rest of the fundus, and located 2 disc diameters temporal to the disc. Within the macula, you may note the foveal light reflex. Then switch the ophthalmoscope to your right hand to examine the right eye. Check for the same characteristics.
Now I'm going to take a look at your ears. Turn your head to your left.
For this part of the examination, begin
And now
by
to the right.
inspecting the external ears.
And back to the center.
Normally they are equal in size, match the color of the person's facial skin, and show no lumps or lesions.
Do you feel any tenderness when I pull on this?
No.
Next, move the pinna and push on the
How
tragus.
about now?
They should feel firm, and movement should produce
Any
no
tenderness
pain.
now?
No.
Now palpate the mastoid process,
Okay, good.
which also should cause no
Any
pain.
tenderness here?
No.
Then inspect the external auditory meatus, which should have no swelling, redness, or discharge. Based on the size of the meatus, choose
Sue,
the
I'm gonna
proper
take a look at
size
your ears
speculum and attach it to the otoscope for internal ear inspection. Tilt the person's head slightly away from you. To straighten the ear canal, gently but firmly pull the pinna up and back.
Now we're going to check your ears.
For a child under age 3, pull the pinna down to straighten the ear canal. Hold the otoscope upside down along your fingers and brace the back of your hand against the person's cheek to steady the otoscope. Then insert the speculum carefully into the ear canal, which should appear patent. It may have some cerumen, but should have no redness, swelling, lesions, foreign bodies, or discharge. Next, observe the eardrum, which normally appears shiny, translucent, and pearly gray. Its cone-shaped light reflex should appear in the antero-inferior quadrant. The umbo, manubrium, and short process should be visible through the eardrum. At the edge, the annulus should look whiter and denser.
Everything looks fine in that ear. Now I'm going to check the other one.
The entire eardrum should be flat and have no perforations. To test the person's hearing acuity, begin with the voice
All right,
test.
Sue, I'm going to give you some words to repeat after me. But first, put your fingers in your right ear and wiggle them gently.
Mask the hearing in one ear by placing your finger on the person's tragus and rapidly pushing it in and out, or having her do this with her finger.
Football.
Then test
We're
the
gonna
other
repeat it
ear
on the other
by
side.
whispering some two-syllable words from 1 to 2 feet away. Normally, the person correctly repeats each word after you say it.
Ping pong.
Airplane.
Airplane.
Then perform the Weber test.
Okay, Sue, I'm going to do a few more hearing tests.
Place a vibrating tuning fork in the middle of the person's skull and ask where she hears the sound.
In both
She
ears.
should hear it by bone
Good. Now I'm
conduction
gonna test a
equally
different
loud in
location.
both ears.
Let me know when you don't hear this.
Also perform the Rinne test. Place the stem of a vibrating tuning fork
Now.
on the person's
And when you
mastoid
don't hear
process
this.
and ask her to signal when the sound stops. When she gives the signal,
Good.
quickly
We're gonna do the same
invert the
thing on
fork.
other side.
Hold the
Let me know when
vibrating
you
end
don't
near her
hear
ear
this.
canal and ask if she can still hear it. Normally, she should hear sound twice as long by air
you don't hear
conduction near
this.
her ear as she can by bone conduction through her mastoid process.
Now.
This normal response is a positive Rinne test. After you complete the examination, share your findings
Okay,
with the
so your
person
exam is
and
done.
discuss any
Everything looks
questions
fine.
she may
Eyes
have.
and ears are healthy.
Also take this opportunity to teach her about health promotion
Probably have it
topics.
checked about every 2
And remember that
years.
your
Make sure your
assessment of
prescription's
the
still
head,
valid.
eyes, and
Unless,
ears
of course, you're having a
collects
problem.
vital data
Sue.
that will guide her care accurately and effectively.